So, Mr. Chairman, President, ladies and gentlemen, we are doing the intervention Takashi arteries more than 3 decades. And our incidence of carotid involvement is 7.7% of cases, and where the renal is the commonest, 76% of cases. Just with 5 minutes, you see, we've done the 36 patient, 40 lesions. Our success rate is 70% of cases. And all the lesions of the carotid dilated by all cases, the coronary balloon. And we have done the balloon, and most of the cases balloon angioplasty. Out of 28 patients, only 4 cases we deployed the same expanded stent, wall stent only. Only 4 cases. We have do the all most of the cases we are happy to dilate the lesion to get successful result. Now this is the patient. So 15 years before, I taking the follow-up of the 5 to 15 years follow-up during my period. I work in the subject 1972. So this patient, 7-year-old girls, presented with recurrent convulsion, you see, and arthralgia, a low-grade fevers for 2 weeks. He came to me by convulsions. You see here, the right carotid totally occlusions, and the tenderness of the right carotid also. And we tried, I thought maybe it is the most likely, maybe the recent onset, and it is the infective origin, and only for the 4 weeks, 2 weeks getting the arthralgia and fever. So I tried to cross with the coronary balloon only. Only the coronary guide wire. And really we have successfully crossed the lesion, and 3.5 balloon was sufficient to dilate the lesions. So therefore, here is the thing, ultimate result of the balloon dilatation, and here the balloon on 3.5, so a good result. And the repeated convulsion really is stopped. Even now, it is this patient, 12 years follow-up, he is doing well. Even 7 days before you have seen, there's some bruise on the neck, but no symptoms at all, convulsion, anything. I tried to request her to do the angio, but it's not permitting. But duplex angiography, the echocardiogram shows just some irregularity, but no much flow obstruction in this patient. Yeah. Now another patient, the 15-year girls, severe occlusion, rectal appearance of the whole external carotid artery. And this patient, again, after crossing the plane BMW wire, and first the 3 coronary balloon, then 5 size of the peripheral balloon, we got the result. So I will not give this stent. This is the excellent result, and his symptoms really is fully disappear. Even now, 7 years follow-up is doing well. Now another patient, you see, this is the youngest patient to me. That is a 5-year-old girl, fever, arthralgia, C-reactive protein 15, ESR 120. So we cannot diagnose. So therefore, Takashi to be diagnosed when the fever of unknown origin must be kept in mind. So we cannot, without index of suspicion, we cannot diagnose the aortic arteritis on the active stage. 5 years, the youngest patient on my CC, there is some left carotid artery, one is the, you see, involved with left carotid, one minor criteria, and a patient having the TIA-like features and 2 times convulsion before coming to hospital. Then there is very activity of disease there. So really we have tried to avoid do any intervention when there is activity of disease. But when the patient is symptomatic, we have to do something. So therefore, plain balloon put here, coronary balloon, sufficiently restored the near normal circulation of brain. We put him the steroid 30 milligram for 6 months, then even 5 years continue 2.5. He is doing well. No activity of disease at all, and all the years are also normal, and it is 5 years follow-up is doing well. Last patient, particularly the severe obstruction there. So stuttering hemiplegia, 30 on girls. So therefore, I only use the stent when there is repeated stenosis or it in long lesions. So I cope the self-experiment stent, good result. Now, in a study, the complication rate during the procedure on the major embolic stroke only 1, but after 6 weeks, the stroke fully disappeared, this patient. And during the procedure, transient neurological deficit, 3 cases, then after the procedure, there's no neurological deficit persistent. And follow-up period 5 to 15 years, 7 cases restenosis seen, that's managed by the stent, 2 cases, 1 surgery, and 1, there is again balloon, repeated balloon. And out of 4 stent, the 1 case is stent deformation seen. So this may result with the 5 to 15 years period. Thank you very much indeed.
You had some, not a lot, some neurological complications. So do you think we have to use embolic protection also? Because in general, we don't use embolic protection for Takayasu, but considering your complication,
particularly everyone, all the interventional cardiologists in India, starting with George also done so many cases from Vellore. We routinely give the balloon, particularly if the burn effect is there. But we reluctant to do the intervention because of activity disease. But some cases must be symptomatic, otherwise never do it. Asymptomatic case, never do it. George has done so many cases. George, please comment.
Yeah.
Okay.
But do you use sometimes embolic protection for some specific patients? I know you don't use, but...
No, if we actually see angiographic thrombus and you're dealing with a very tight lesion, we do that, but that's in a very small minority of cases.
Not in routine.
Yeah.
Not routinely.
We use the stent only is the aneurysm which contain the thrombi. Otherwise, all is some activity disease try to reluctant to do put the stent. All routine in the balloon, if patient symptomatic only.
Okay, Mr. Chairman, we'll move on to the next presentation. Thank you, Professor Panja. Ladies and